My name is Graham Love, Chief Executive of the Health Research Board, and you're all very welcome this morning to HRB30, our 30th birthday, actually founded in 1986 by statutory instrument.
Research is not some abstract, lofty issue that happens very far away. It's something that's very real and very tangible and benefits our patients on a daily basis. So much of the debate is always on the size of the health budget. It's regrettable that more of the debate is not about what do you do with that health budget to best achieve the right patient outcomes and indeed improve outcomes and experiences for healthcare staff as well. So the HRB, through its work, provides us with an evidence base that can inform policy development, and we've seen this in so many areas.
So since 2006 the HRB have been funding my research almost totally with contributions from Horizon 2020. This has enabled me to develop a very strong research programme which has then influenced patient outcomes for women and babies in the West. The funding has also allowed me to influence policy and guidelines both in Ireland and in Europe. It has facilitated us receiving the presidency of the International Association of Diabetes and Pregnancy Study Groups.
The development of the clinical research infrastructure here over the last 10 to 15 years has really come forward. It's now possible to test drugs and interventions. Patients are being put on better medical devices and drugs, and really their health is being advantaged by this infrastructure.
The Health Research Board Clinician Scientist Award, which I was awarded in 2007, changed my life. Not only did it allow me to build a large and internationally competitive research group, but it actually effectively set up the first academic unit of neurology in the country and set up the first chair of neurology in the country, which I am lucky enough to hold now. So effectively the Health Research Board has put academic neurology on the map in Ireland and has put neurology right in the centre of neuroscience research in Trinity College.
You will notice we have plenty of researchers, but we have an incredible array of people, from the health service executive, from charities, from the political dimension, TDs, hospital CEOs. In other words, a very strong set of people, including the key decision makers on the research user side. The case we're making here is that there's considerably greater value to be got from the 14 billion spend through the generation and the use of evidence.
Research, policy and practice are three difficult areas with their own particular languages, their own particular ways of doing things. But if we're going to be successful at integrating the three, we have to work together.
Given a situation, particularly where resources are very tight, it's really important, and more important than ever, that we use the evidence to ensure that we introduce policies that work. We need to be very clear about those systems that actually work and deliver in terms of patients, and we need to learn from that research.
I think public patient involvement is going to be a key development over the next 5 years, and we've made it a priority. Data is a massive asset. There's a lot of it out there, and our capacity to link it, share it and make meaningful findings for policy and clinical practice is going to be of enormous impact over the next 10 to 20 years.